And welcome back to Mountain Health Today. I'm Ted Owens, your host. We're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Specifically, we're talking about the Incline Village Community Hospital and how it has really changed and evolved in the last 4 or 5 years in tremendous ways. Harry, in the last segment, we were talking about some of the many providers that are in the area. Dr. Koch is one of those providers, also family practice, longtime provider.
Right, and so we have the previous list that we shared are primarily on the second floor of the hospital, which is a large multi-specialty clinic footprint. It also,
and that's an important distinction, because
correct.
When people think of a clinic, sometimes they think it's a storefront somewhere else. It's
right.
in the hospital building. Second
floor and open 7 days a week. We also have a sleep program up there in addition, but it is new that just within the last several months we started making it available 7 days a week. We really felt our community deserved that. Our goal is to keep our community well, to give them alternatives other than visiting an ER, an emergency department, or inpatient beds. That's the right thing to do, and it's been really well received.
Let me ask you a question, because it takes commitment from your provider core,
right,
to fill those gaps, to maintain a 24/7 operation, and
right.
that was missing in the past as well.
Right.
So there's a great deal of commitment, both from management and administration, but also on the part of the providers that fill those gaps. How does that work?
Absolutely. So we have to have a dedicated team 24/7 for the ER, and then we also have supplemental physicians who are on call for admissions should they occur, and then we have a team of physicians and physician assistants who work primarily on the second floor, making sure that we're covered 7 days a week there. We have some important additional specialties that we're going to be looking at down the road too, as we have really examined community need. For example, gastrointestinal services will be something that we're going to be adding down the road. We're going to be expanding the surgical area where it's only had one OR room in the past, where we're going to have an additional special procedures area there, and we can start to do some GI procedures and do those local, so patients don't have to travel to Reno area or the Nevada area, or even to the Truckee area, that they can get that on a part-time basis as well. We're adding mental health services in the near future as well. So again, carefully looking at gaps that are needed in our community to really improve the holistic health of residents in that region.
Well, the older I get, the more I appreciate some of those gaps being filled.
Absolutely.
So tell me a little bit about some of the providers. Some are doing work over in the Truckee side, and then also over in the Incline Village side.
Correct.
Is that a difficult thing to manage from your perspective, or is it working fairly seamlessly?
We believe it works pretty well, but it really requires very dedicated, mission-focused physicians who really love our broad community, who make themselves available where our community is, so that, you know, Dr. Oleg Vayner, pediatrics, has a busy practice in Truckee, but he wants to make sure locally pediatrics is available in Incline Village. Dr. Skolnick in cardiology, very busy in the Truckee area, but also to go again where the population is at Incline and make sure they have local cardiology services, especially with some of the difficult weather that we have from time to time. Also, the expansion of orthopedics, greater orthopedic coverage locally, the addition of GI coming in the future, mental health.
Tell me a little more about orthopedics. How extensive is the service line in Incline?
It's starting off in a narrower fashion initially, but I would say that orthopedics is going to be a fairly robust service line, not only with the how orthopedics is viewed nationally by Medicare and other payers and treatment modalities. Orthopedic care, believe it or not, is becoming more and more outpatient, a little bit less inpatient, and so we really believe that Incline Village Community Hospital is ideally suited to be a rural hospital of tomorrow, if you will, for whether it's orthopedics, whether it's GI services, or, other just non-invasive services as well.
So you're really kind of growing your service lines in accordance with some of the demographic data that we're seeing. We're seeing an older population choose to retire or to live in our environment, and these are the service lines they need.
Absolutely, and it's the data approach to what are those gaps, and is it realistic that we can fill that and remain a sustainable, high-quality rural hospital here.
That's a lot of work, I know, on the recruitment side and on the provider side, to find folks that want to be in the area. Very excited about the fact that part of your core are folks that have grown up here and chosen to return. Right. Very fortunate to have that, and very fortunate to have the leadership that you provide and your team provides. This is Ted Owens, your host, Mountain Health Today. We've been talking about the Incline Village Community Hospital with Harry Weiss, President and CEO at Tahoe Forest Health System. Harry, thanks so much for sharing such great news and spending time with us. Very, very enlightening, and
thank you.
Very pleasing to hear all of the great things going on. Thank you all very much for watching. We'll see you soon. You're watching Mountain Health Today. I'm Ted Owens, your host. I'm with Harry Weiss, President and CEO of the Tahoe Forest Health System, and we're talking specifically about the Incline Village Community Hospital. Harry, we left off a little bit talking about the history of that little hospital in Incline and all of the good work that it does, but let's talk more specifically about what we do there. What specific services can the public expect?
The hospital really offers a 24/7 emergency department. It has 4 inpatient beds. It also offers a large multi-specialty clinic on the 2nd floor of the hospital, and we can talk about the nice variety of services there. But anybody who would have visited this hospital 5 years ago, and then if they came today, they'd say, wow, it doesn't even look like the same facility. Has a beautiful exterior, has a beautiful interior. The emergency department has been totally refreshed. The lab has been totally modernized. Radiology has had new equipment added. The whole 2nd floor has been modernized. So they say, wow, this is a totally different looking and feeling. And then, of course, the services and the physician providers that are there is amazing.
So it's it's been completely revamped, as you just pointed out, but it's also important to point out that there's a true partnership with Tahoe Forest in that endeavor, but very much more importantly is many of the interior improvements as well as the state-of-the-art equipment, that's all been community supported through philanthropy, correct?
Absolutely. That's a beautiful part to really see all of these philanthropic efforts, whether it was ER, whether it was lab, whether it was new radiology equipment, even the support on the 2nd floor, to have philanthropy really help that. The new exterior was funded more from an operational perspective, but philanthropy has been really critical there. We've also really included it in our strategic plan and master plan. So as we're really looking at the people are choosing to come there in greater numbers. For example, we experienced about 26% growth in fiscal year 19 into June 30, 19 versus the year before, which is pretty phenomenal. And so we've really been looking at a master plan. How can we continue to meet those gaps in healthcare that are realistic realistic to be achieved in a small community.
When you're talking growth, just so the folks at home understand, that's not financial growth, that's annual patient
visit and overall growth. It could be physician office visits, it can be ER, it can be lab, x-ray. So that's an overall volume growth percentage year over year.
Now you mentioned physicians. There have been some changes there too. We've got some exceptional physicians working in Incline. Dr. Kim, for example, share with us a little bit of the dynamic change that has occurred in the last couple of years.
We're really pleased to have been able to deliver on bringing critical physician providers and physician assistants to this community. Dr. Michelle Kim is a great example, very beloved by the community. And her patient volume has just grown very rapidly every month and every year that she's been there. I believe even some individuals who might have had concierge medicine somewhere have dropped that, and they like the quality and the connectivity that she provides. So she's just one of many providers that we can talk about that have been added.
So you've got many providers, high quality, 24/7 services, some services. All of that has led to, as you pointed out in the first segment, very high patient satisfaction scores.
Right.
Have you seen scores like that in a rural setting, in a small hospital like this elsewhere in your career?
Extremely rare. I've never seen a hospital with a 99th percentile plus year after year. I haven't seen a facility score those levels year after year.
And in addition to that, in your long career, the services that are provided at that hospital are exceptional in the array of the services provided, correct?
Correct.
Also highly unusual.
Whether it's lab or radiology, but I think from a physician perspective, so we have Dr. Pato, who works part-time in family medicine, Dr. Kim, Michelle Kim, who's full-time, greatly beloved, Dr. Josh Skolnick, who works part-time cardiology. So it's really rare to have some of these part-time specialties. We have Dr. Oleg Vayner, part-time pediatrics, Dr. Matt Mingrone, part-time ear, nose, and throat, Sasha Musso, who's a physician assistant. We also have Dr. Jonathan Hagan, one of our younger orthopods, who's there part-time as well, and also Dr. Marshall Clyde, who joined us, who grew up in the area. What's been really special in our health system is to bring back physicians, nurses, physician assistants who might have grown up in the area, and we have more than a handful now, including Dr. Marshall Clyde.
And Dr. Kim.
Dr. Kim as well, who have come back home. And Dr. Marshall Clyde has allowed us to open up a very special feature, which is to have 7-day-a-week services on our second floor clinic, so we can remain top of mind for every resident and guest.
And that's where we're going to go in just a second. You're watching Mountain Health Today. We're talking about the exciting goings-on at Incline Village Community Hospital. We'll be back in a minute. Welcome back to Mountain Health Today. I'm Ted Owens, your host, and my guest is Harry Weiss, President and CEO of the Tahoe Forest Health System. And today we will be talking about the Incline Village Community Hospital. Harry, welcome. Thank you again for being with us and sharing your time.
Thank you. Happy to be here.
Well, today we're going to talk about the Incline Village Community Hospital. Why don't you, for the folks at home, give us a little background. Where's the facility located? And a little bit of its history.
Well, you know, there's 3 hospitals that serve the Lake Tahoe Basin. Incline Village is the 3rd hospital to arrive on the scene back in 1982.
Tahoe Forest and Truckee and Barton.
Correct,
down in
yeah.
the South Lake.
Tahoe Forest, 1949, Barton in 1963, and Incline comes along in 1982.
So Incline came along in 1982. It was a standalone?
Absolutely, a little freestanding hospital. In its first 15 years of life, it had many stressors and may have closed, if history is accurate, or really struggled to near closure almost 3 times during its first 15 years of operation. And we've had the privilege of being connected or affiliated with Incline Village Community Hospital since about 1997, so roughly 23 years of really stable and growing and improving activities, which we can talk more about.
Yeah, part of that acquisition was to provide the stability that was necessary to keep it open full time. It's a interesting community. You have full-time residents, but you also have a lot of snowbirds or people that travel away.
Right.
And was that one of the stressors that was afflicting the early version of the hospital?
Well, it is a smaller community, and the hospital tried different boutique strategies, and many of them didn't work. But the important thing is the community really recognized the value and importance of local healthcare in that community, and they really wanted it. And so we've seen over the years just a thoughtful, growing community partnership of love for the services it provides, and really joining with us and expressing the needs so that we could understand what those gaps in healthcare were as well. So it's been a partnering effort over the last 23 years that we can talk about a little bit.
Well, in the next segment, I think we're going to go there to what it has become today. But let's. I know this is very important to you. Let's talk about that community love for this hospital through philanthropy, a very strong foundation
right
in the Incline Village area.
And that comes from several perspectives, only one of which is this facility has on a very regular basis been performing at the 99th percentile in terms of patient satisfaction. So they have really enjoyed the quality and the professionalism of the team and the care that they get, and they've recognized how it has saved lives of many community individuals, over the years as well. So that's all been really vital there so far.
So on the management side, because Tahoe Forest is a district hospital in California, what kind of support is lent to the Incline facility by Tahoe Forest?
It enjoys shared management services from administration all the way through from accounting, payroll, HR, dietary, housekeeping, and so forth. So it operates with a very strong clinical footprint and very light overhead.
So that probably was the biggest difference between the establishment of the hospital originally and today. It was overburdened with those office or back office costs.
Right, absolutely. In a small hospital setting, overhead can be very, very challenging to even having a chance to be in a break-even mode.
So I want to come back a little bit to, we'll talk about it more in another segment, but the philanthropy part of it, that's a big foundation.
It is, and I think that it would be really remiss not to really talk about how the community has come together in greater numbers every year. We have a variety of philanthropic events every year, and it's been amazing for me every time I'm there just to really feel the love of the community towards that health system, and then to see, not only to feel the love, but to see them open their checkbooks to really donate from a philanthropic perspective in larger amounts each year for either critical programs that were hot topics each year, but to also watch it migrate towards the philosophy of the general guarantee that we want to see great health care always exist in Incline Village. And to see that mature has been an amazing journey of support that I think will create that guarantee that great health care will always always be in that community.
But we'll expand on that in the next segment. I'm talking today with Harry Weiss, President and CEO of the Tahoe Forest Health System, specifically talking about the Incline Village Community Hospital, which I believe today is a great example of a real community hospital, very well supported.
Absolutely.
I'm Ted Owens. This is Mountain Health Today. I'm with Harry Weiss, and we'll be back with you in just a moment. Welcome to Mountain Health Today. I'm Ted Owens, your host. Mountain Health Today is a program of outreach to the community on all things healthcare, issues that are very important to you and me. You can see us on Lake Tahoe TV in the Truckee area on Channel 14, North Lake Tahoe Channel 195, and South Lake Tahoe Channel 12. And of course, you can always see episodes on tfhd.com. Today our guest is President and CEO of the Tahoe Forest Health System, Mr. Harry Weiss, and we'll be back in just a moment.